Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
And in today's video, we're going to talk about the two radiopharmaceuticals used in nuclear stress testing, thallium and technetium. Thallium was the first agent used for nuclear stress testing. It acts as a potassium analog and is actively transported into the myocardium through the sodium-potassium pump. Technetium, on the other hand, is an isolated element that does not bind to cell receptors by itself. To localize it in the myocardium, it must be attached to ligands to form radiotracers. The two commercially available ligands are sestamib, tetraphosmin. Both of these ligands diffuse across the cell membrane and accumulate inside the mitochondria. Thallium emits lower energy photons and has a longer half-life compared to technetium. Technetium emits higher energy photons, meaning fewer photons are absorbed by the body and more reach the gamma camera, producing better image quality. Its shorter half-life also reduces the patient's radiation exposure time and allows higher doses to be administered while keeping the overall radiation dose the same. In fact, nearly 10 times more technetium activity can be injected compared to thallium. Because of these advantages, thallium has largely been replaced by technetium-labeled radiotracers. One potential drawback of technetium tracers is their gastrointestinal excretion, which can increase hepatic and GI uptake, sometimes interfering with the visualization of the myocardial walls. The myocardium is divided into 17 segments based on 3 short axis slices and 1 long axis slice, representing the entire left ventricle. The anterior and septal walls are supplied by the left anterior descending LAD artery. The lateral wall is supplied by the left circumflex artery. The inferior wall is supplied by the right coronary artery RCA. Each of the 17 segments is scored using a 5-point scale. 0 equals normal, 1, 2, 3 equals mild, moderate, or severe reduction in uptake. 4 equals no uptake. A segment with a score of 3 or 4 is suggestive of a significant coronary artery stenosis. Diagnosis is based on comparing stress. No defect in both stress and rest equals normal myocardium. Defect in both rest and stress equals myocardial infarction. Defect only after stress equals myocardial ischemia. Nuclear stress testing is most useful in patients with an intermediate likelihood of coronary artery disease. For example, a patient with a 50% pre-test probability. A positive test increases the likelihood to 80%. A negative test decreases it to 10%. But for a patient with a 5% pre-test probability, a positive test increases the likelihood only to 20%. A negative test lowers it to 1%. This is why experts recommend regular exercise stress testing for patients with a low probability. Coronary angiography for those with a high probability, as a negative nuclear stress test would still leave them with a relatively high risk. Thank you so much for watching. If you enjoyed this video, please give it a thumbs up.